Infectious disease specialist Dr. Zain Chagla joins us again via Skype to answer all questions regarding COVID-19. Good morning and happy Friday.
Yeah, thanks, Bob. How are you?
Good to see you. Let's start with the looming twindemic with COVID-19 and the flu. And actually, starting with the flu shot, there's a lot of concern about big lineups and waits of getting flu shots booked. But I think you're saying we shouldn't be panicking yet?
Yeah.
Or at all?
It's incredible. I mean, people are taking this in stride, and I think there's been the most enthusiasm I've seen of any year, maybe outside of 2009, where people have wanted flu shots. So remember, these things are released in batches. We have no flu circulating in the Hamilton community, which is good. So there is still time. Again, we usually start our flu shot campaigns after Thanksgiving, so this is just the beginning of it. Just be patient. That there will be shots for everyone. Just don't think of it as a concern that you can't get one today.
Right. So with a lot of cases, both flu and COVID-19, what would that look like?
Yeah, they'll have similar symptoms. I mean, there's a few differences between the two. COVID-19, one of the symptoms is loss of smell, which is very sensitive for it. But, unfortunately, things like fevers, muscle pains, aches, diarrhea go up both ways. So it's important that people get their flu shots when it does come, because for everyone, they'll have to go to an assessment center to get tested if they do develop those symptoms. Similarly, in the hospital, we're going to deal with the surge of people with influenza and trying to deal with that and COVID-19 and everyone else. There's a lot of overlap and a lot of resource pressure from it.
One of the treatments we hear a lot of is remdesivir. We have some leaked data that it's actually not very effective in terms of mortality rates in hospitals. And didn't Canada just spend $90 million?
Yeah, so... it's hard to say. I mean, it's a huge trial that was done through the World Health Organization. In fact, St. Joe's was one of the sites that participated, looking at remdesivir as well as three other drugs, hydroxychloroquine, lopinavir, and interferon as part of treatment. This is the biggest trial to date showing that remdesivir really has no benefit on mortality. I think we all kind of knew this for the fact that the U.S. has been using a lot of remdesivir over the summer, and really we've seen their death rates go up and up and up, so it's probably not a miracle drug. But it is not a great sign going forward. There still probably is a role for the drug. It may make people better a little bit quicker, and so that's still useful for hospitals. But yeah, the price tag that we paid, probably $50 to $90 million for these treatments, the cost benefit is starting to look a little bit more sour than it did originally.
Yeah. I want to get your opinion on a story coming out of Ottawa this morning. An epidemiologist there saying that many scientists disagree with the concept of herd immunity. And so there's kind of a battle among your community here. There's the John Snow Memorandum, which is opposing herd immunity and countering the arguments made in the Great Barrington Declaration that says that lockdown measures don't work. And
yeah,
if you could explain that, and I'd like your opinion.
Yeah, it goes back to the debate is, do you get herd immunity if everyone gets infected with COVID-19, or at least the young and healthy people get infected with COVID-19 and don't pass it on to the elderly? And then you use those people to start taking care of the elderly in that sense. There's a lot of assumptions that go into the Great Barrington Declaration, majorly that herd immunity is long lasting and everyone is immune for life afterwards, and they can't spread the virus anymore, which is a huge jump considering we're starting to see cases of reinfection. So there's lots that is really assumed in the Barrington Declaration, which isn't necessarily real to practice. If it were ever to come true, we may deal with hospital systems that are deluged with people, not dying, but essentially collapsing our healthcare system. And then in countries that have really tried to go for herd immunity, Sweden in particular, when you look at the data around how many of them actually got immunity to COVID-19 or had been infected with COVID-19, it's still like 20% despite having huge amounts of death to get there. So, I think it's a dangerous declaration. The John Snow letter really takes a look at more civil measures, contact and case tracing, and supporting populations, which I think, unfortunately, are the way going forward. I don't think there's a shortcut out of this through herd immunity.
Yeah, so as we're doing here. So before we go, less than a minute left, but I want to get your guidance on a couple of things. Of course, the Spinco Gym, that's a story this week and the huge outbreak there. They were following guidance. Clearly the guidance wasn't working or wasn't enough.
Yeah. I mean, we're discovering more about this disease. I think unfortunately, if you have droplets, you have those bike wheels moving and spinning, and the droplets may be propelled more than the typical 2 meters that we keep going. And unfortunately, I think that's what happened with here on top of ventilation. It's a good lesson to be learned, I think, for
Should
provincial and
people wear
national.
masks at all times in gyms? Should people wear masks at all times in the gym?
I think it's probably an important step. Like, it's one of the settings where it's not really used, but I think it is an important step, especially with the aerosolization of these droplets.
Yeah. Okay, thanks again. Have a great weekend. We'll talk to you again next week. Infectious
problem.
disease
Take care.
specialist, Dr. Zain Chagla.